Hello, it's Dr. Rhonda Johnson, and today is Friday, October 2nd, 2020. Today I'm going to be talking about super spreaders, and I'm going to be reviewing some common terms that I think are very important as this pandemic unfolds. And also, I will be discussing the recent positive tests for President Trump. Well, let's start off with super spreader events. Super spreader events are known to be responsible for 80% of COVID-19 infections. Now, a super spreader is a person who's infected with COVID-19 and transmits it to an unusually large number of people. Experts have said that super spreader events may be responsible for at least 80% of the COVID-19 infections. Through contact tracing of COVID-19 cases, it has been learned that the following activities can act as super spreader events. These include closely packed outdoor markets, dances, crowded bars, graduation parties, pool parties, packed church services, weddings, singing in the choir, birthday parties, and perhaps political rallies. But again, these are reported factual cases of how the virus has spread in super spreader events. We already know that there are super spreader places where the virus can spread easily. Those include prisons, nursing homes, college dormitories, food processing plants, and other places. We know that this virus has been raging out of control pretty much throughout the world, but certainly here in the United States since the start of the summer. So with President Trump's diagnosis, and again, I don't wish anyone a positive COVID-19 test or an experience with this novel coronavirus. But with this testing of the President and the First Lady of the United States, we will see what ideally should happen as a best practice in managing this disease. So let's go through some of these, what we can expect to see. One is containment, which will be a coordinated governmental response. It'll include testing on a massive scale of the people who have been in contact with President Trump and contact tracing and quarantine. Because again, the president has been in contact with a lot of people lately, and they are already starting to do his timeline and do, analysis on the media sources of everyone who he's been in contact with. The next thing you'll learn more about is quarantine. Quarantine is a more aggressive prevention strategy that is used when someone has been exposed to COVID-19. And for anybody, not just including the president, if you have been exposed to COVID-19, you should quarantine for 14 days. Quarantine involves restricting your movements to only what's absolutely critical, wearing a mask in public, and maintaining a safe physical distance from anyone who doesn't have the same exposure. Now, isolation is the most serious form of protecting others around you. If you have a confirmed or a suspected case of COVID-19, these people should remain separated from everyone who's not sick, including those who live in your household. That means you stay at home in a room that's separated from the rest of your family, and you monitor your health for 10 to 14 days. Now, speaking of the president, we don't know yet if he's symptomatic. And again, this involves knowing the symptoms of COVID-19, which can include symptoms that appear 2 to 14 days after exposure to this virus. Those can include fever, chills, cough, fatigue, muscle or body aches, headaches, a new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea, and shortness of breath or difficulty breathing. So what we can know for sure is that the president and his family will get the best of medical care. I realize that this may be a time of uncertainty for many people, but the president and his family will get the best of medical care that's possible. The president's diagnosis of COVID-19, his test, will be the ultimate game changer in terms of news and awareness of this pandemic, probably for the next 14 days. People, be prepared for massive information overload from this. This will dominate the news media probably for the next couple of weeks. A good outcome will be that we will all learn more about our government and our leaders and the process of power preservation. So my advice to anyone who is watching me is to stay calm, please. Be careful about your intake of media. Continue to go about your life. Focus on what you have control over, and let this be a fresh reminder that this pandemic is real. It is not fake news. Be re-motivated, if that's a word, to wear your mask. Be re-inspired to keep washing your hands and keep everything clean that is in frequent eye contact, and to stay more than 6 feet apart from anyone who is outside your usual home circle. Remember here that this virus has one goal, and that is replication. COVID-19 does not discriminate based upon age, gender, race, political party, or religion. In my previous videos, I've said that leadership is the stewardship of lives entrusted to you. So be that leader, folks. Be that leader in your home, your family, your community. We've got to maintain this mindset shift. We have to continue to change our behavior and our practices to save our life and those of the ones we love. This is Dr. Rhonda Johnson. My views are my own. Stay calm, folks. Don't panic. Wash your hands, wear your mask, and watch your distance. Today, and until we get this pandemic under control. This is Dr. Rhonda Johnson. My views are my own, and have a blessed day.